Yeah, absolutely. I mean, I mean, this study looked into HFpEF and HFmrEF. So we had an ejection fraction higher than 40%, which I think is a standalone feature that we looked into this broad range of ejection fractions. And for this patient population, we do not have specific guideline recommended therapies. Guidelines recommend to optimally manage comorbidities such as hypertension, diabetes, renal dysfunction, and in consequence, many of these patients are on a RAS inhibitor, be it an ACE inhibitor or an ARB, but the subset has neither nor, so is RAS inhibitor void. And what we tested here now, and I think this is also a standalone feature of PARRALAX, we said if a patient was on an ACE inhibitor before recruitment into the study, he will be kept on an ACE inhibitor, enalapril. If the patient was on an ARB before recruitment into the study, he will be randomized to into the ARB stratum, and Valsartan is the comparator. And if he had no RAS inhibitor at all for treatment of comorbidities, then the comparator is placebo, so Sacubitril Valsartan versus placebo. This is what we understand by individualized background medical therapy. And the interesting aspect here is that the benefits of Sacubitril Valsartan, when we look into NT-proBNP, were irrespective of the individual background therapy for comorbidities. So Sacubitril Valsartan was better as compared to an ACE inhibitor, or compared to an ARB, or compared to no RAS inhibitor at all. And the neutral effects with 6-minute walk distance, we had the same observation. That was irrespective of the individual background therapy. I would like to mention one other interesting finding. In the Paragon HF trial, there was a trend for reduced events, specifically heart failure hospitalizations. They nearly missed the level of significance by a few events. And so we looked in a post hoc analysis in PARRALAX. We looked into severe adverse events related to heart failure hospitalizations. And what we could find, and that was a substantial number of events, that in these over 2,500 patients that we followed over 6 months, there was a roughly 50% reduction in heart failure related severe adverse events in PARRALAX. So that was not a pre-specified or adjudicated endpoint, but it is a very interesting signal. So we see exactly the same thing that was observed in Paragon in our safety analysis data set, reduction in heart failure hospitalizations, which I also think adds to the overall knowledge of Sacubitril Valsartan in HFpEF and mREF.